Have our Gracie 1, 2. We have Gracie 1, 2, 11, 12, 13, 14. The higher the number, the further back in the mouth. I love the 1, 2. I use the 1, 2 all the time. I use the 1, 2 all the way back through the premolars. But for your practical, you won't be doing that, okay? So let's try to figure out which end to use. We have our long terminal shank. Our terminal shank is, right before the cutting edge. Here's our terminal shank. I hold the terminal shank perpendicular to the floor. It's pointing toward me. I see which end slants down. This end slants down. This is my cutting edge. If you're really having a hard time figuring it out, you can look. We have the number 1 and the number 2 on the side. You have the saying, you have the right to be odd. If the number 1 is pointing down here, the cutting edge is on the right-hand side. I rather just kind of look at it and see. But what I do, okay, so now I've identified the cutting edge. I just follow it with my eye, and I walk it towards number 9. It's going to take me right to the mesial, okay? So in clinic, this is what you're going to do in clinic. You're going right into the mesial. Terminal shank parallel, roll the tip tight, short overlapping strokes. If I want to do the distal, I just flip it around. The other side is for the distal. In your practical, it's the same thing. I mean, you can in your practical start at the midline and walk around. I don't really need to see that, but if it wouldn't be wrong in the practical, but if you just go right into the mesial, maybe start at the line angle, but look at the rubric for that. But I really don't want you to do that in clinic because, like I said, for the practical, we're trying to get you to remove calculus from the whole tooth, and that's very rare that you're going to have that.
Yeah, I think that's what they taught in class.
I think it was like midline.
Midline. Okay, so just do that. So do midline. Like I wouldn't, if you just went right to the interproximal, I wouldn't grade you off. Maybe some instructors would. So start at the midline and very slowly walk your way around. Okay.
Which one was that?
That's for the 1, 2.
Oh,
That's our
1,
2 for the anterior.
So is it like midline to mesial, midline to distal?
Yes, yes, yes. So what you would do, it would kind of look like this. You would, if you're doing the practical, it would look like this. Around here. Okay. You can do it, start here, very slowly, walk around. You're going to roll. You're going to end just right there. Then you're going to flip it around. And exact same thing. Very slowly walk it around. Roll it in between your fingers, but keep that tip really tightly adapted.
For the practical, are we going subgingival?
Yes, slightly subgingivally. Yep, just very slightly. You don't have to go too far down. Okay, let's go to our 13, 14, our 11, 12. Our 11, 12 Gracie is good for the mesial surface of the posterior teeth. And how can I find it? Yeah, okay. Oh, shoot. They may have given you... Oh, here, never mind. Here it is. Okay. So the 11, 12 is good for the mesial surface of the posterior teeth. So this is kind of weird. I think like this end might have bent, but so I'm going to show you this end. Terminal shank is perpendicular to the floor. It's pointing toward me. I look for which end that slants down. This is the cutting edge right over here. Or when the instrument is pointing toward me, we refer to this first bend. 11 and 12-year-olds like to go outside and play, so the cutting edge is on the outside. Okay, I do the same thing. I identify the cutting edge and I watch it with my eye. I'm going to pretend like number 9 is a premolar. That's not going to work for me. It's going to take me to the distal, so I flip it around. This is kind of weird. It's bent, so it's not really the best instrument here. But so here's my cutting edge right here. I'm going to follow that. That's going to take me into the mesial. In clinic, what you're going to do is you're just going to go right into your mesial. Terminal shank parallel, roll the tip tight, short overlapping strokes. For your practical, you're going to, it's bent, so it's not really the best instrument. But anyway, you're going to do the same thing that you did with your 13, 14 universal. You're going to start at the distal and you're going to walk all the way around very slowly, roll into the mesial, okay? But in clinic, just go right. There's no reason to do all that, stuff on the buccal, okay, or the lingual. All right, our last one is our 13, 14 Gracie. That's for the distal surface of the posterior teeth. Back to the 1, 2. When I'm in clinic, I use my 1, 2 all the way back through the premolars. It works really nice, but for your practical, you won't be doing that. Okay, so then we have our 13, 14 Gracie, and that's going to be for our distal surface of our posterior teeth. There we go. Okay, so again, I'm going to identify where my terminal shank is. Here's my terminal shank. It's perpendicular forward. It's pointing toward me. This end slants down, or I'm referring to this bend. 13, 14 year olds like to stay inside and play. Let's pretend like number 9 is a posterior teeth. I identify the cutting edge. I'm walking it. No, that's not going to work. So here's my cutting edge. I watch it. Yes, that's going to go to the distal. So this is kind of an easy instrument to be tested on. Just go right to your distal. Terminal shank parallel, roll the tip tight, short overlapping strokes. Read the rubric. I don't think it says start at the line angle, but maybe it does. So just very slowly walk in to, like, I wouldn't give you any points off if you went right in, but maybe some of the faculty wants you to start at the line angle and walk in. But just read your rubric to see what it says. But terminal shanks parallel, roll the tip tight, short overlapping strokes, okay?
Because that bend was going to the left, you go that way.
What's that?
Because that bend was going this way, you know you're going to the left.
Well, yeah, so your cutting edge, your bend is, the cutting edge is down here because it's on the inside of the bend. 13, 14 year olds like to stay inside. So really just identify the cutting edge and watch it, okay?